Hello, good afternoon, or good morning, or good evening to everyone watching us today. We're here again Wednesday around 5 p.m. at Central European Time in the headquarters of the World Health Organization with Dr. Mike Ryan and Dr. Maria van Kerkhove to answer your questions about COVID-19. Before we start and we open the floor to you, I would like to wish happy St. Patrick's Day to everyone celebrating, but especially to Dr. Mike Ryan. He's our dearest Irishman and Irish representative here. So happy St. Patrick's Day, Mike.
Thank you very much indeed.
And
St. Patrick's Day to everyone out there.
Normally, as far as I've learned through Irish friends, this would be a day of big celebration, not only in Ireland, but everywhere around the world with Irish people. Maybe we can start with giving some advice to people who still wish to celebrate, how to celebrate it safely in this time of the pandemic, or to remind them on how to stay safe.
No, indeed, this is I think for Ireland, the second year in a row. It's unprecedented to see St. Patrick's Day cancelled no more than national days in every country. They're very celebrated. But in Ireland, St. Patrick's Day is particularly precious, and to the Irish diaspora across the world, and those people who feel Irish and have Irish friends, we all celebrate this day. Not about celebrating the country or the geography, but just celebrating that sense of Ireland and what it represents to us all. And it's going to be important to stay safe wherever you are, and whatever you're celebrating today. And it's the same old word, we've been saying it for so long now. Avoiding crowds, keeping your physical distance, wearing your mask, washing your hands, making sure you're in a well-ventilated spot. And if families are getting together, because most things are shut down in many countries, if families are coming together, then it really, has to be within the rules that have been established for those gatherings, and that they're different in different countries, so I won't go into them in detail. So but there's one thing I need to do.
Please.
Because I got a card today to wish me a happy St. Patrick's Day. And this is the hand of Farah Doyle, 3-year-old. And I got this beautiful hamper this morning from Maria Doyle and from Farah through my great friend Fiona, who works here with us here at WHO. And it was lovely. I walked in this morning, there were Irish flags all over my desk, and there was a hamper. And there was this beautiful card, and that's Farah's hand. And solidarity and everything is a word, but it was just so nice this morning to have that gesture from my fellow Irish people. So I'm very happy, and please celebrate safely wherever you are. It's a wonderful day, but let's not make it a sad day for others later. Thank you.
Thank you, Mike. And this is a great gesture, and again, a reminder of how we can make each other happy still during these difficult times, and to make someone's day by sending a card or reaching out through social media, digital platforms, and saying hi and wishing well. I see that some questions are already coming regarding the new COVID-19 virus variants, and we'll talk about it and control measures in today's session. But we've also seen that our followers have been concerned about the news around the AstraZeneca vaccine being temporarily paused in some European countries, and doing an ongoing investigations on some adverse events. I know that both of you are not vaccine experts, but I'm sure that our viewers would like to hear your opinion on why countries sometimes make those precautionary measures, that some countries make those pauses in vaccinations as a precautionary measure.
I can start. I think, first of all, our opinions. It's not about Mike and my opinions on this. It's about, how vaccines are developed. They're developed as safe and effective vaccines. There are many, many clinical trials that are underway before they are licensed, before they are used in populations. And that's really important, because people have heard a lot about, these vaccines are developed so fast and so rapidly, but safety is not skipped. ever, so all of those clinical trials are underway, and there are many vaccines that are still in clinical trials. But the ones that are in use have been approved because they have passed these safety and efficacy. And what we do is when these vaccines are rolled out, people are monitored. And so we're rolling these vaccines out in so many different countries. And some countries have and a precautionary approach, have paused the use of AstraZeneca. But the group of SAGE, the group of WHO, and the group of the many different groups have been looking at the studies, and this is a normal practice. Whenever there is a signal of something or a potential signal, it doesn't mean that there's an association, but they have to look and they have to do a proper study to evaluate whether or not it's associated with the use of the vaccine. The use of the vaccine far outweighs the risks. We know that vaccines that are out there are safe and effective, and it is really important that individuals get vaccinated when it's your turn, when you are offered, because vaccines play a vital role in protecting against severe disease and death, and they're really an important tool in the toolkit for ending this pandemic. They're not the only one that's out there. There are many other measures that are out there as well. As you hear Mike and I talk about, we're broken records on this, and we will continue to be, because there are a lot of things that we can do to protect ourselves. Vaccines and vaccination are an additional important tool. The benefits of the vaccine and the AstraZeneca vaccine outweigh the risks. But there's many studies that are underway to evaluate how these vaccines are being used in individuals. Thank you, Maria.
I think Maria makes all the important points, that the systems are in place to pick up those signals. And again, it's important that is invested, that's been looked at, and WHO's advisory committee on vaccine safety is also looking at that data, which is coming in from the countries, and will make the right determination on that. But this very often happens. I think the difference in this pandemic is that all of this is happening in very much in the heat of the moment, and with everything and as it should be in the public domain, but it's gaining a lot of minute-to-minute attention. And sometimes it takes a few days to sort out the data and see actually what is happening, what the true signal is. And that's difficult to do when the news reporting is hourly. And that it's great to have this transparency, but it also tends to create confusion in people's minds, because if I hear this hour, I hear one report, and 2 hours later my friend hears another report, and then it's the difference between these reports, and then everyone says, oh, does anyone really know what's going on here? And then people get very nervous. Vaccination is the single most effective health intervention ever devised in healthcare delivery. Vaccines have saved millions of lives, but vaccines are biologic products, and we have to use them carefully and safely, and as Maria said, these products have been proven to be safe. But when you start to use vaccines at large scale, problems that were potentially very rare can crop up, and that's why we have this post-distribution enhanced surveillance. And in fact, we've been watching very carefully for anything that may go wrong. So let's wait and let's see. We would advise people to keep taking the vaccines. Right now, this virus has a much bigger chance of doing you a lot of harm than the very, very potentially tiny risks associated with this vaccine. Also, from the AstraZeneca perspective, again, this is a vaccine that was developed in public-private partnership between the Oxford Group, between the company, and it's one of the few products that's actually out there on the market that's been developed on a no-profit basis, and that this vaccine has been developed and distributed at a cost price. So there's also been a very strong impetus from both the academic and the private partner to be very transparent, to carry out these studies, to put that information out quickly. So I think it is important that we recognize that the company and the Oxford Group have been very open and are trying to really do the right thing in this particular situation. And I think we need to be very careful that we don't end up overreacting and damaging the product in people's minds until we're absolutely sure that there actually is a problem. And right now, that is not certain. And let's wait for the data to be looked at before we make any conclusions.
So can we just also put in the chat below that WHO has issued a statement on this, and we can say that, at the present time, WHO considers the benefits of AstraZeneca vaccine outweigh the risks and recommends its continued use. So I think that's important to state, and we can put the full link to that statement there. And I think you hear a lot of us all the time. I mean, Mike and I think, and many, we preface a lot of our statements with "at the present time," especially when we start talking about the variants. At the present time, because everything that we are learning about the science of this, and this is not particularly related to vaccine, but just related to everything over the last 15 months, we're constantly learning. And these studies, all of these studies are underway, and science is a process. And that's good because we have the systems in place to pull this information really together quickly, to do a proper assessment and to release information. And this evolves all over time. So we issue guidance, we issue statements, we do it through social media. There's lots of different ways in which we release the information. But maybe we can put that full statement in the chat below so people can see. They can read that directly themselves.
Thank you very much. And we have already tweeted about the statement, but we will be posting now on other platforms via comments, so you can definitely read immediately what Maria has been referring to, and Mike as well. There's a lot of questions already arriving, but before we move to this, I would just like, as usual, for you to give us an epidemiological update, as we've been seeing that the number of cases are growing almost in all regions. So just to see where we at this moment in comparison to previous weeks.
I'll start because I think you're going to get some questions on variants, you said as well, so she's more of an expert on that than me.
I don't know about that, but go ahead.
Over the last number of weeks, we've been talking about how the number of cases has been stabilizing or dropping, but in fact, now we've dealt with a 10% increase in cases in the last week, we've come back up over 3 million cases, new reported cases per week. That's lower than the peak in January when we went to 5 million, but it's higher than it's been in the last number of weeks. And for the past 3 weeks, we've seen increases. It's still true that the Americas and Europe represent over 80% of those cases, but we've seen new cases and rising cases in almost all regions. So I think it's time for us all to take stock, because as vaccines are rolling out and we have that hope of vaccines give us, as societies and mobility increases, and with the implications of variants, I think the dangers are right now that unless we're extremely careful with our own personal behavior, extremely careful with the measures we have in place, we risk allowing the virus to really rear back up and cause us a lot of difficulties. And I've said it before, we've said it before, the last thing we want to do is to lurch back into more and more lockdowns. We've seen in certain European countries, and Italy and other places have had to resort to more stringent measures. Very disappointing for people coming up to Easter, especially in a country like Italy, where Easter is a hugely important celebration, more than St. Patrick's is in my country. And these disappointments that communities have to suffer are, I think, even more disappointing now, because we get our hopes up. But it really does come down to our own individual behaviour and how we comply with the advice of governments and others, and then how quickly we can all get vaccination out. So I would say the situation is stable. It's not rising exponentially, but I think there's enough of a signal in the data that would clearly say to us that the disease is turning a corner in the wrong direction, and we need to get that under control. And we need to do that in almost every region. This is a phenomenon that's going to affect many countries in the coming weeks, especially as they open up. And Maria can speak maybe later to how variants may be helping to drive that. In other words, this virus is getting slightly harder to control, and we're slightly less able to make the effort to control it. And you don't need a big change. If the virus becomes a little bit more transmissible and we get a little bit less careful, the two factors multiply each other, and you end up in a very difficult situation very quickly. And I think that's what I'm worried about. The gap between the virus's transmissibility and our effort is beginning to grow again. And we're going to fall behind the virus again. We were catching up, getting on top, and we were on top. And for us to lose, it means the virus has got to get better or we've got to get worse. And at the moment, the virus may be getting slightly better at what it does, and we're getting slightly worse at what we've been doing. And that worries me right now. It's not out of control in the sense that we've made huge progress since January, and everyone deserves huge credit for that. But we're beginning to see worrying trends in a number of countries.
can you identify what are the main drivers in transmission at the moment? As in winter, we could see that after holiday season that we could see increase in cases, and now we are seeing as well, I think over 120 countries started vaccinating their population. So are there any reasons identified why we can see this increase in transmission and cases again?
Well, I think it's a combination of factors. I mean, as Mike has said, there are worrying trends that are happening right now. It's moving in the wrong direction. Over the last 3 weeks, we have seen globally an increase in transmission. In the last week, there's been a 10% increase in case incidents around the world. And we've had increases in the last week in almost every region with the exception of Africa, which is stabilized in a sense. And there are a combination of factors. We know what drives transmission. Social patterns, that are our social mixing, the way that we come into contact with one another drives transmission. The virus needs people to transmit between. So if we give it an opportunity and people have more contacts, think about how many people you come in contact with every day. Has that changed in the last week, in the last month, in the last few days? And if so, why? These virus variants are complicating matters. There are several virus variants that have been detected around the world that have increased transmissibility. There are some mutations that have been identified in these variants that allow the virus to bind. One of the reasons allows the virus to bind to the cells more easily and infect the cells more easily. That's one of the hypotheses of why they're more transmissible. If you have a more transmissible virus and you spend time together, the possibility of you infecting someone else or being infected increases. So you need to minimize that opportunity. And so what we saw over the December-January period is that the holiday patterns of when people and families mixed together increased the number of contacts each person had. That drove transmission exponentially in some countries. I mean, some of the epicurves, the curves that you see, I think everybody knows across the world what an epicurve is now. Instead of growing very, very slowly, they were like this in some countries. I mean, we've never seen epicurves like that before. But when that social mixing stopped, when people stopped mixing with others and families stopped mixing with others, and in some countries there were quite some stringent measures that were put in place, transmission dropped. Now what we're seeing is with this slight increase, and you heard us say this, either it was last week or the week before, or one of our recent press conferences, this is worrying because we now have vaccines being rolled out in a number of countries. Some are letting down their guard. And this is not to scold anybody because everybody is working so hard, but we need to stay the course. We need to make sure that we adhere to the measures that are in place because it is within our control to drive down the transmission, even with these virus variants, even with variants that are more transmissible. And we have to continue to stress that. So in the areas where you live, follow the local guidance because transmission is so different around the world. We have seen some countries bring COVID under control and their societies are opening up, and that's fine. But in other countries where transmission is starting to increase again, we need to make sure that we reduce our contacts, we avoid crowds, we wear our mask, we ensure physical distancing everywhere we are. We make sure that we have well-ventilated rooms. We open the window. It's as simple as opening the window and the doors where we are to get some fresh air coming in. If you are sick, stay home. If you are a case, make sure that you are isolated and you get appropriate care. If you are a contact, stay in quarantine. Keep yourself isolated from others. Every single one of those measures that was put in place in the past applies now. And I think that's what people don't really want to hear, because we just want this to be over. But we can continue to drive down transmission, and it's still within our control somewhat to be able to do that. So it's important that everyone continues to hear this and really, stay the course because we are doing well, and we don't want this virus to resurge.
I think we would like as well to remind our viewers, even if they are getting vaccinated, they still need to continue with applying those protective measures and the full toolbox that we have. And in that regard, maybe Maria or Mike, you can answer this question coming from Sage Shopping. Why continuing to force people that have been vaccinated to wear masks? Is there any science behind it to explain?
Yeah, I mean, we don't know fully yet to what extent being vaccinated prevents you processing the virus and spreading it to somebody else. There's no question that all of the vaccines currently on the market prevent severe disease, they prevent hospitalization, they prevent death. We still have to get the data on to what extent they protect you from being infected or potentially processing the virus. So you could be perfectly well. I'll use maybe another example that we have real evidence for with polio. We have a vaccine called IPV, which is the injectable polio vaccine. That protects you against polio, and you will never become paralyzed. But it doesn't stop you actually processing the virus in your gastric or gastrointestinal system. To stop that, you have to take the oral vaccine in order to do that. So sometimes a vaccine can prevent you being sick, but it doesn't prevent you actually getting the virus and then potentially passing it on to someone else. Now, we are seeing some good preliminary data that's beginning to suggest that the vaccines are working and are preventing a significant proportion of transmission, but not completely. So in that sense, that's why we're advising that people retain those measures. But we are looking at what advice we can give to people, particularly vaccinated people, meeting with vaccinated people and other things, what specific advice we can use to help people become more mobile. And again, when we're talking about wearing a mask, and we're talking washing your hands, again, if you're vaccinated and you're an older person and you're protected, then wearing a mask and washing your hands isn't exactly earth-shattering. We're asking people to maintain those precautions for themselves and for others, and as a matter of solidarity with everyone in the community, until we understand more about the extent to which vaccines will actually protect against transmission.
That's right, and we're looking at this regularly. So with all of our guidance that we have out, we're looking at, we're always updating with new evidence that comes in, but in particular there are two aspects that we're looking at our guidance on. One are the virus variants, in terms of what do we know about these variants? Is there any change in the way the virus transmits, besides increased transmissibility, but is there any different modes of transmission? So far there are no differences there. Does it cause different disease severity? We're looking at this constantly with all of the variants of interest and the variants of concern. And we're looking at all of our guidance as it relates to vaccination and in terms of individuals who have been fully vaccinated. And this is important. And what we are thinking, and we're talking about this every day, in fact, we're having these sessions and we're discussing with our international networks around this of consolidating the evidence. This will be a rapidly evolving space. And in fact, we're thinking of how can we issue guidance and updates to our guidance more frequently as we learn more information about this. But as Mike said, the studies are underway. The studies that have been designed to evaluate safe and effective vaccines, the end point of those studies is looking at severe disease, looking at disease and death. There are some preliminary studies that are looking at transmission and looking at infection, and we are seeing some positive signs there, but everything is preliminary. So until we know that someone who is vaccinated cannot pass the virus to somebody else, it's important that these measures are in place. And as Mike said, people are doing this every day. And if you think about how you get up in the morning, if you leave your house, you think, do I have my hand gel? Do I have my mask? Is it a clean mask? Do I have the plastic bag so I could put some, the dirty mask in it? You think about through your day how you can minimize your risk. There is behavior change that we're seeing from young individuals all the way to older individuals. The big concern are people who have really been isolated for a really long time, and we understand the need to see family and to hug grandchildren and all of that, and we all feel it as well. But this is a space that is evolving and it is growing. The science is growing really rapidly. So we will be updating our guidance more regularly in this aspect so that we can give advice to individuals who are fully vaccinated. But right now, we need people to continue to adhere to the measures so that we can prevent any potential onward spread.
Thank you, Bob. And I'll now start passing all those questions about the virus variants. First question that came just as we started the conversation was from Cynthia Dowd, saying scientists are concerned about the new variants that are surging. I would like to know better about the P1 variant identified in Brazil and the real protection that the vaccines are able to promote against it.
So that's a great question. P1 is one of the variants of concern that WHO and partners are tracking around the world. And what we are looking at when we say we're tracking these virus variants is, one, we're looking at the spread of the virus. Where is this virus with these mutations, with these are detected? And we do that through genomic sequencing, which is happening around the world. And then we look at, for each of these variants, what do we know about transmission in terms of increased transmissibility? Does it spread more easily? What do we know about severity? And what do we know about any potential impact on diagnostic tests to be able to detect cases with this variant? We look at any of the medical therapeutics, the drugs that are out there. Do they still work against people who are infected with these variants? And is there any impact on the vaccines that are out there? For the P1, there are some preliminary studies that have been published by groups in Brazil. And we're very grateful for all of the research that is ongoing in Brazil. It's very collaborative. It's working across many different disciplines. We've seen clinicians and mathematical modelers and epidemiologists and public health professionals come together to study these variants. And again, this is all happening in real time. We do see some indication that there's increased transmissibility with the P1 virus variant. And there are some studies that are underway looking at severity. We don't have a complete picture yet around severity. However, when you have more transmission, that means you have more cases. And if you have more cases, you can very easily overburden a healthcare system if people develop disease, seek care, and need to be cared for by medical professionals. And if you have an overwhelmed system, then people may not be able to receive the care that they need because there aren't the beds. There isn't the time to be able to care, and you could therefore see some increased hospitalization, and you can see increased deaths. And so our colleagues at PAHO and our colleagues in the country office are working with all of the different at all of the different levels within Brazil to support the work that's ongoing there to study this variant, to support there are a bunch of epidemiologic studies that are underway, hospitalization studies that are underway, support to make sure that oxygen is received in country. And so we're learning about this. But the P1 variant, this is circulating in Brazil. It has been detected in some other countries as well. Do you want me to talk about any other variants or just stick to the P1?
The next question actually is coming from Jacqueline Cassis. There are now many variants, each one different. What are you doing about them? So maybe now you can give us, answering her question and giving us the overview of other variants that we are tracking and concerned about.
So there's a lot that's ongoing related to virus variants. The first thing that we're trying to do is study where SARS-CoV-2 virus is. And that's about, good molecular testing, these PCR testing, the antigen-based testing. In some countries, they're even doing self-testing. We need to know where the virus is. And in looking at those viruses, we look at any changes. So it's about detection, first and foremost. Where are there any indications that there's changes in the virus? Changes in the virus is natural. It's called virus evolution. And this is a natural process. And after 15 months, the virus is under pressure to change. It doesn't have any personality. Please don't write to me and tell me that viruses are not alive. I do know this. Viruses become more fit. And becoming more fit means that there's a fitness advantage that they can infect more individuals. So we are tracking mutations over time. And we do this through our surveillance systems that are worldwide, our epidemiologic surveillance, our molecular surveillance, and our genomic surveillance. And one of the things that's weak across the world is genomic sequencing. It's improved over many years, but if you look at currently the number of sequences that have been shared, I think there are more than 700,000 full genome sequences that have been shared. And this is wonderful. I mean, it's really fantastic, but they come from a handful of countries. And what we need is more sequencing to be done in more countries so that we can look at changes in the virus across many different countries. We're working with our regional offices to enhance regional approaches to this and build sequencing capacities in country and make sure that we support the platforms that can hold the sequences and do more analysis with this. That's not enough, because not only do you monitor the sequence and the changes in those sequences, you need to understand, what does this mean? And so there are many studies that are underway, and WHO is working with partners to collaborate research, to coordinate research on these different variants to determine, what does it mean? I mean, if they have these mutations, what do these mutations mean? Some of the mutations will change the virus's ability to bind to the cell. Some of these mutations will impact the body's ability to develop neutralizing antibodies. So all of that is being studied across the world. So each time you have a variant, And the more you look, the more you will find. They have to be studied properly and they have to be studied thoroughly. So we are looking at, through these studies, any changes in transmissibility. We're looking at any changes in disease presentation and severity. And then we are looking at any potential impacts on our countermeasures, on our therapeutics, our diagnostics, and our vaccines. So it's a huge global program right now to monitor and assess each of these variants. And we're classifying them at the moment. So you may hear a lot about in the media a variant identified in California, or a variant identified in South Africa, or a variant identified in France. And so what we're doing is we're working with our partners to classify them, to say, okay, what do we know? And we characterize them. Are these alerts that we need to look into? Are these variants of interest, which require more study? Or do we know that these are variants of concern, which means it triggers a system to be able to say, okay, much more work is needed to be done to look at the impacts on our available vaccines, for example. So far the vaccines work against these variants of concerns that we are tracking, including the P1, including the B1351, which was the variant identified in South Africa, and the B117, which is the variant that was first identified in the United Kingdom. And so this is a process that's in place, but it's something that's continuously evolving, and it involves many, many different partners around the world.
It sounds impressive when you say we are tracking the virus, how it's moving, how it's transmitting, and in my head I just have a big map with different like alerts popping up.
It's exactly what it is, and it's making sure that you have an organized system to track each one of them. I mean, if you look in the media today, right now we have 3 variants of concern that we are tracking. And when I say tracking, that means we're looking at where they are circulating globally, and it means that there are many studies underway. There are 20 more variants of interest or alerts that we are following to determine how important they are. Many of these will go off the radar because they won't be important from a public health perspective, but we have to study each one. And so it takes some time, and that's why we have this massive global architecture around doing this, because there will be a time where we will need to think about our 2nd generation, our 3rd generation vaccines. So we need the process in place to say, this one triggers a new vaccine composition. We have a lot of examples of this. We do this with flu every year. Twice a year we meet to determine the flu composition. And so we need to have that same type of system for SARS-CoV-2, because this is going to be with us for some time.
Yeah, I think that's the key thing. We need to, as we take the heat out of the pandemic and, end the pandemic as a massive killer as it is now, we need to move towards a longer term control program. To be in a position where if we need to change the vaccines, if we need to change the surveillance, we can do that in a normal way. And this becomes more like influenza, where we can manage this on a yearly basis. And it may be that we're going to be having to do that for years to come. On the variants, I said it here at the previous thing, that's the weekly EPI record. It's on the web. That's got an update every single week on the variants, and that has the maps of where the variants are around the world and how far they've got. It has information on the mutations, and it has information on what we're tracking. And it's a very simple way for anyone out there to just look and see what's happening on a weekly basis. And it represents the synthesis of a lot of work. So that's on our website. And also the weekly numbers are on there, and the global maps are on there. And it's a very simple, fairly accessible sort of way of keeping yourself up to date without having to be glued to the TV all the time. Or Twitter.
Thank you both. And Maria, you mentioned that we need more capacities to do genome sequencing. So I hope that this was a good way to attract young people, as you've been inviting people, especially young people, to bring new ideas and new solutions. So maybe this is one sphere of science where we can attract more people to study and to contribute to, if not now, but in future, to innovative solutions.
More women. Can I put a plug out there for more women in science and engineering fields and math? Because we need more women out there to be working on these types of fields, and there are some incredible female scientists that are out there. I saw something today that was discussing the Fauci effect, which is warranted and I think is amazing, but I do want to highlight that there are many incredible female scientists out there that are really putting epidemiology and genomic sequencing and phylogenetics and medical research and oxygen. I mean, just the study of oxygen, we see people saying like, I didn't even think about that before and how important that is. We need more creative minds and young minds in thinking through some of these solutions. Some of the solutions we're dealing with are archaic in that sense, but there's a lot of new innovation. We're into digital tools and artificial intelligence, and WHO is keeping up with this, and we're pulling all of these sources, this information from open sources, epidemiologic information from open sources is pulling things from multiple languages, and we're really in a new era, and WHO is part of that, but we need more, and we need more women in science and medical and engineering fields.
So girls,
Sorry.
this is some celebrate March as a month of women. So we are still promoting that message.
And maybe could I just add, because sometimes we think the solution is just more data, and more data is really important. But data can overwhelm you too. We need better ways of analyzing that data and the analytics and linking the data. So when we get genetic data, we need to know what the clinical data is from the hospital, and we also need to know what the data is from the lab, and we want to know what the data is from the public health service. And when you integrate those data sources and you have someone who can do the analytics and visualize that data, and some of the most incredibly innovative stuff is not been done by the epidemiologists and not been done by the scientists, but by the visualization experts. Because when you look at a map, or you look at an image, or you look at a cartoon, we process most of our information visually. We can process millions of pieces of information at one time. When you look at a map and look for directions, you're processing huge amounts of information. But that technology of the map has been designed to allow me to process all that information. We need everybody on board with that. So people who are really good at communications, people who are good at simplifying and telling the story. So we're not talking about pure innovation and people sitting in labs and all, trying to make new vaccines. We need innovation across the whole spectrum of functions, and we call them essential public health functions. And when we mean that, we don't mean the doctors and the nurses and the scientists. We mean essential public health functions, and being a communicator, or knowing how to teach people about communications, or knowing how to influence people's behavior in a positive way, that's just as vital as building a new vaccine. So we need to maybe broaden our idea of what we mean by science. Social science, behavioral science are just as important in epidemic response as the lab science. Not to denigrate the lab science, but sometimes when we talk science, people think we're talking about, people like Maria and me, test tube people with white coats on. It's not. The real front line of epidemic control is in communities. And we've seen that. Where have we failed all the time in this response? We've failed to convince people that it's absolutely necessary to wash your hands or wear a mask or avoid crowds or open the windows. If we could get more people to do that, that's as good as vaccine. So sometimes we tend to revert to technological solutions for what are essentially behavioral challenges for us all. It's easier buy the solution than change your behavior. And we have to find both. And I think the ones that I think that's where I think the most innovation is needed right now is in behavioral sciences and in gaining new knowledge about we as communities, as families, as individuals, react and understand epidemics and how we behave during them and how we process information and advice and how do we build trust. Everything about this pandemic is about trust. If you tell me something, I have got to trust that you're giving me the best information and that you have my best interest at heart. Now, how many people in this response have complained that they don't trust the government, or they don't trust the scientists, or they don't trust each other? How much have we lost through a lack of understanding of how to build trust and build community and build solidarity and build equity? And I think that's just as scientific as building new vaccines.
Thank you, Mike. And you've been saying many times we don't want to go back to old normal, but we want to build. So I hope that this is as well motivation for all of us to, as we want to build a better world, to look holistically in different sciences, science disciplines, and also what could we have done better in this response so that we can do it better next time.
Yeah. But as Maria said, and I'll say it, we need more women and girls in science, but in STEM, in the science technology, yeah, because that's where I think there's a, there's a different, women bring a different way of looking at problems, sometimes a different way of innovating, a different, and I see it here. I mean, we've got Maria here, who's a stellar example of that, someone who's leading the science of WHO on this, but there are others. I mean, in our incident management system here, for actually the majority of the pillar leads in this response are women. Janet Diaz and leading our whole clinical effort, and Melinda Frost leading on our risk communications, community engagement. Yourself, Maria, with the overall leadership. We've got Gabby Stern, she's probably looking over my shoulder now, I don't know, leading on our comms, and we've got, so this is not a response. What's really, really refreshing for me, having been around this place for a very long time in and out, this is my first big, huge epidemic response where the predominant professional class at the management level are women. And it's having a really positive impact on the way we're dealing with this. And if we're becoming more open and broader in our thinking and more sensitive to issues around behavior and community and family, it may be because we're becoming more balanced and more diverse in the representation that we have in our secretariat. And, you do much better when you reflect the community you serve, because you're more able to adapt to what the community actually needs. So WHO is an ethnically diverse and now gender diverse organization, and that makes us better. But that's not where science is right now, globally, and we do need to keep pushing,
Can I touch upon something you also said about building
Please.
back, and wanting something better and not going back to the new normal? I mean, not going back to the way that it was. That starts now. I mean, I've done some interviews recently where people keep talking about when the pandemic is over. And this pandemic will be over. We will get to a point where we will celebrate this, right? But the changes that we need to see need to start now, because all of us are going through something horrible right now. And this is a traumatic experience for all of us, no matter where you live. Many people have lost loved ones. They are dealing with tremendous sorrow and grief, and I don't think as a global community we have actually grieved yet. I think we are still in the trauma of all of this, and there will come a time where we will need to do this. But I think we need to do the changes that we want to see now, and it's from everything that we see with our kids, and I see this with my own kids. We see this through all the way up through leadership, and we think about this public health infrastructure that you've heard Mike and I use that phrase more probably every time we have spoken. We are hearing that public health infrastructure be used in all countries right now, but the time to build that, the time to reinforce that, the time to strengthen that is now. It's not when this is over, because everyone will move on to the next challenge, the next problem, because there will be more problems, and there are so many things that the world has to deal with. This change has to happen now. We need workforce in place. We need people who are there, who are community leaders, who can help. The countries that have done very well during this pandemic have built this from their communities. They have community health workers that can go door to door in the millions, and in some senses maybe not that many, but they're used strategically and they're used compassionately. And we have testing. There's a lot of good testing around the world, but it doesn't mean you have to test everybody all the time, every single day. If you can do that, great, but it's about strategic use of your resources. So some countries that didn't have everything in place in January and February in 2020, a year ago, what they did is they activated their system. They knew that there was something that needed to be activated. They heard us, raise the alarm and issue the global call on the 30th of January last year, issue the global response and activate their systems. And they didn't need, millions of people. They used what they had strategically because they knew how important that was. And I think we need to be thinking, all of us, in our daily lives as individuals, as families, as communities, but also as leaders and as governments, what should we be doing now with the trauma that we have now to build systems that could put us in a better place for the next one? There will be another one. There will be the next one. We need to be in a better position. And we need to use, unfortunately, the trauma that we're in right now to make those changes, because now is the opportunity to be able to do so.
Thank you, Maria. And speaking of using tools strategically and on what science has already developed, I'm going now back to a question coming from a Facebook user how do you detect viruses? What kind of tests are used? I know that we had some sessions where we were explaining on different tests, but maybe we can remind our viewers once again, how do we really detect this virus?
How do we detect this virus or just viruses in general?
This virus, SARS-CoV-2.
SARS-CoV-2. So when this virus was detected, it wasn't even named SARS-CoV-2 because it was a novel pathogen. And so what happens is around the world, there are a lot of systems that are in place that are looking for new pathogens, emerging pathogens we call them. And many of these emerging pathogens come from animals because these are called zoonotic viruses. It means zoonotic means it passes between animals and humans. So there's a lot of surveillance which is ongoing around the world in wildlife animal species, and we work with our partner agencies at FAO and OIE on this, looking at domestic species, because we want to see which viruses are circulating in the animals, and if they are, do they pass between animals and humans? And if so, why? What are the conditions in which some of these viruses pass between animals and humans? So there's a lot of work that's ongoing in communities that have very close relationships with some wild animals, but also I did my PhD on H5N1 in Cambodia, which was such a wonderful experience. And if anyone is from Cambodia is watching, I miss my time there tremendously, because we were studying, this was back in 2006, we use what is called a One Health approach. Before, I think it was called a One Health approach, which means you look at the environment, you look at animal populations, you look at human populations, and the environment in which we live, and the environments in which we work. And you look at how pathogens can jump between animals and humans, and we do this through surveillance activities. In this pandemic, the beginning of this pandemic, there was a signal that was detected. There was a cluster of pneumonia of unknown etiology, and that means that a cluster means there was a group of individuals that were detected in a system in China, in Wuhan, that were clustered in space and time, that had pneumonia. So they were sick. And from the lab tests that were done, it wasn't some of the common pathogens. It wasn't influenza, it wasn't SARS, it wasn't MERS, they looked for Legionella, I think they looked for adenovirus, a number of respiratory pathogens, and they determined that it was something new. And the way that they were able to determine that it was something new was through genetic sequencing, looking at the DNA of the virus itself, the backbone of the virus, and they do that through sequencing. And a lot is happening. There are surveillance programs around the world that are always on the lookout for new pathogens. And so that's what continues to happen, because we are constantly on the lookout for this disease X. And with the R&D blueprint for epidemics, which was established after the 2014-2015 Ebola outbreak in West Africa, it was looking at what are the high threat pathogens that we need to have medical countermeasures for. And you think of Ebola, you think of Lassa, you think of coronaviruses, and then we also included in that list disease X. What will be the next one? SARS-CoV-2 is disease X, and there will be another one. And so it's making sure that you have the systems in place. And in fact, this is why vaccines can be developed so quickly for this virus, is because vaccines had started before last year on MERS coronavirus, another coronavirus, and for SARS coronavirus. We were able to quickly adapt that work once we had the sequence for SARS-CoV-2. So there's a lot of work that's underway that are looking for these new pathogens. There are many that do, spill over, that they have limited spread. They don't spread into global pandemics. So there's a global community that is out there, and I hope there are more people that go into this field, because it's quite fascinating to understand, how viruses evolve in animal species and why some of them jump to humans and others don't.
Thank you, Maria. And then when we got finally the sequence, then the new work started in developing tests. Did we develop new tests, or we adjusted existing tests to identify this virus?
We had produced target product profiles for drugs, for vaccines, and for therapy, for diagnostics before, as part of the disease X process. So we were well ahead with our partners outside. And remember, our partners are in the public and the private, the academic and other sector, working with CEPI and Gavi and many others. So this is not just WHO, and I see we, I'm not saying the WHO we, I'm saying we, the global health community, yeah. And when we do speak that royal we, it's very much that, and it's meant in letter and in spirit. So I think we had some of the way, but definitely getting those initial sequences is very important. And remember, picking out a signal. We talk about atypical pneumonia. What's meant by atypical pneumonia is pneumonia that's not typical, right? So it does what it says on the tin. About 20% of pneumonias, people get admitted to hospital for pneumonia. There are millions and millions of cases of pneumonia in the world every year. And about 20% of them are considered to be atypical. When the sample goes to the lab, it comes back initially negative for all the regular pathogens. And then the laboratorians have got to go to work and think, okay, we need to do more testing. And then they find out that it's chlamydia or it's Legionella or one of these other more weirder bacteria, or they find out that it's a virus that we haven't detected before. But it is hard to pick out a new signal from these hundreds of thousands and millions of these cases of pneumonia. So picking that signal out from the noise is tough, and that's what we're constantly trying to do in surveillance. But with regard to testing, the simple stuff for you being unwell and getting tested, and whether you've got to decide whether you've had COVID or you haven't. For me, the tests break down into I have COVID, I had COVID, or I never had COVID, right? That's how the tests break down. So what we do if we want to see if you've got an active infection is we look for the virus, or we look for bits of the virus. So when we look for the virus, we look for its genetic sequence. We try and actually find the viral sequences, and that's what PCR testing is. And that's what they call PCR process. We also have antigen testing, which an antigen just means a protein that the virus has that we can test for. So we just try and find bits of the actual virus. That's all it is. It's nothing too sophisticated. I mean, we often use these words and everyone gets confused, right? PCR means we're looking for the virus's genetic sequence. Antigen testing means we're looking for bits of the virus to say it's here. And those two tests, one of those two tests can tell you whether you have an active infection. The PCR genetic testing is a bit more sensitive. Whereas the antigen testing can miss sometimes and tell you that, doesn't find the protein and it says negative, doesn't always mean it's negative, and that's one of the issues we've had with getting high quality antigen testing, but it is improving. And then if we wanted to test whether you've ever had it before, say you're not sick and I want to test, I was sick 3 months ago, I wonder if I had COVID, you get a different test, and that's called serology. And all that does is tests, it doesn't test for the virus at all. What it tests is for the antibodies that you developed against the virus. So it says, Mike, you have antibodies against SARS-CoV-2, so you must have had an infection in the past. And depending on the type of antibodies, and you hear people talk about IgM and IgG, depending on the type of those antibodies, you can tell whether you had the infection recently or whether you had the infection a long time ago. So I think sometimes people get confused with the testing and which test. I think it's relatively straightforward. So if you're sick today and you have a fever and you go to the hospital, they're going to test you with the PCR test. If you're a contact of a case and people are doing community screening, you might have a PCR test, but they may just give you an antigen test, a quick test, a rapid test. And if someone is trying to, as we've all been bled by the Swiss authorities, to check whether we've had previous infections, and that's what we're doing with the Unity studies, trying to see how many people around the world have been infected, and Maria's been leading on that work with many others here, Isabel and many others. And that's a fabulous project where we're actually trying to see all around the world in many, many different countries who exactly has been infected. And not just where, but who has been infected. So
we do that because it helps us understand the extent of infection that may have been missed by a surveillance system or a PCR test. Because the PCR test, the time in which you can test positive is limited. And it depends. It depends on if you were asymptomatic, if you had mild disease, or if you had severe disease. But an antibody test can actually look backwards. We actually don't know how long the antibodies last. There's some indication they can last 8-9 months, maybe even longer. And so we can look back. And so some of these serology studies, these that are looking for antibodies, will say, okay, among this population, if I look at different age groups, if I pick a random sample of different age groups, we can test them for their antibodies, and then we can make some kind of estimates at the population level of how many people may have been infected. And that's really helpful for us as we think forward. We're doing a lot of discussions, we, WHO, with our partners, I have to be careful about our we. I mean we a lot by our partners, and you've heard me say this before. People say, Maria, how big is your team? And I think thousands, because we are our partners, and we're very grateful for our partners. But WHO has been discussing internally as well as with partners about 2021, this year. What does this year look like? What is 2022 going to look like? And the way that we think about this is we need to understand how much of this virus has infected people so far, and serology helps us with that, and then also the molecular testing helps us with that. And the vaccination coming online is going to be helpful because we knowing how many people have received the vaccines, they have protection as well. We don't know how long that lasts as well, but still that combination of information helps us understand who has antibodies, who has some protection against reinfection, who has some protection against this. And that helps us think through different scenarios of where we're going. People want to know, when's this going to be over? Give me a date, and I wish we could do that. But again, the determination of this still depends on us. So vaccines and vaccination are an incredibly powerful tool, but they do not come at the expense of the individual level measures. We will say this over and over again. And we think about what we do in terms of prevention, in terms of control, in terms of treatment, and in terms of vaccination. And if we can prevent infections, that's key. We prevent as many infections as we possibly can, because there's a number of reasons for that, obviously, because we don't want it to spread. We don't want people to have severe disease. We don't want people to die. We think about control. So if somebody is infected, what do I do? And how do I make sure that the virus stops with me, that I do not infect somebody else? I get the care that I need, but I don't allow the virus to pass to somebody else. We think of treatment. If somebody is sick, how do we treat them to make sure that they don't progress to severe disease? And if they have severe disease, that they don't die? And we think of vaccination. How do we protect the most vulnerable, the most at risk? And then eventually we can vaccinate the rest of the world. But we still need to make sure that those who are most at risk are receiving vaccine in every country. That is still not happening yet. And we really need to see that happen around the world.
Thank you, Maria. I know we are running out of time, but I have two more questions regarding the new variants and testing. And the first question is, are you concerned that the existing tests may not be able to identify the new variants?
So the tests currently work against the variants. These tests can detect the variants. And so there is an assessment that is made that is looking at the different tests that are out there. There are different tests, as Mike has explained. Even the PCR tests that he explained, some of them look at different parts of the virus, and so they look at different gene targets, and most of those look at least 2 or 3 different gene targets. Some of those only look at one gene target. Those may not work as well, but most of the tests around the world look for multiple targets, so they still work against that. That's good news, but we're evaluating this. Even the antigen-based tests, the lateral flow tests, they work against these virus variants so that they can still detect.
Thank you.
And again, when we were looking way back at target product profiles, and when we were looking at the original assays and the stuff, we were actually encouraging people to develop multiple targets because we knew virus evolution would happen, and we did not want to put all our eggs in the one basket. So we're reaping the benefits of that now.
Yeah.
Here is the last question coming from our LinkedIn viewer. Could the area where variants are show us about it, why they are arising in such places at different time?
Why are the variants arising at different time?
And my understanding of this question is geographical area where the variant is identified. Can they tell us maybe about the factors why in this particular moment this variant is evolving?
I think the thing with viruses is the more viruses you have, just by number, and the more time that virus replicates, the more chance randomly we will just come up with new combinations. You know, if you keep dealing cards, well, you can get different combinations. If you've got 50 cards in your deck, you get a certain combination. If you've got 5 million cards in your deck, you have lots more combinations. And that's what it is. It's a game of chance. And if you have lots of virus in the community, and the virus is getting, millions of chances to try out its genetic code, eventually one of those random variations in the virus just happens to be more transmissible. And what will happen is that virus will survive a little bit better than all the other viruses. And next week, its children or its progeny will survive even better. And that's how one virus competes out another virus. It's Darwinian. It's exactly the same that goes on in the animal kingdom. A better adapted subspecies or strain will tend to replace all of the other strains eventually. And it doesn't have to be much better. It just has to be a little better. So the more virus we leave out there circulating, the more chance it will happen. There's another thing that can drive virus evolution, and it's something we usually do, is we can put pressure on the virus, and we see this in bacteria with antimicrobial resistance. Sometimes we can use antibiotics against bacteria. If we don't use it properly, what we do is we put pressure on the microbe to evolve. Now, we don't have that so much right now. We don't have a lot of those pressures on the virus. The main reason why the virus is developing, and it's not because of the geographic zone. It's not about the people it's infecting. It's not about the geography. It's about the intensity of transmission. And it's interesting that in areas where we've had very intense transmission in the past, we have more variants. And I think also in areas where, I think, as Maria said, there are more variants out there. We're just beginning to understand the full distribution of variants, and particularly the ones that are of concern. But I would say to people, the less virus in your community, the less chance you have of variants emerging. And that's why we want to make sure we vaccinate people. We want to make sure that people continue with the measures. And I know, again, I'm going to say it again because it's worth saying, the vaccines are a gift. They're a gift of science, and if we can get them distributed equitably, they will save countless lives. But the vaccines by themselves, right now, given their availability, will not end this pandemic. And they in themselves will not stop the variants emerging. What will stop the variants continuing to emerge, what will shut this virus down, is us continuing. If we want to get back to normal life, if we want to get back to going to the shops and going to school, opening up society, the price for opening up society is going to be that we continue our personal behaviors, that we continue to wash our hands and wear those masks and avoid the crowded spaces, right? It's going to mean that public health authorities have to continue with surveillance and testing and quarantine of contacts, and that we expand vaccination as rapidly and as equitably as we can. Remember, countries like New Zealand, countries like Australia, countries like Vietnam, like China, South Korea, many countries have contained this disease without vaccines. And we need to get back down to the numbers in which that's possible. And they've done that by combining all of these different measures and sustaining that over time. And if we add vaccines to that, then it's a massive addition. But we're really concerned at the moment. We're seeing the numbers starting to jump back up. Everyone is beginning to put justifiable hope in the vaccines. And I've said it again and again. The vaccines will end the tragedy of death and the horrific images of the hospital ICUs full. But it will not stop the transmission. And there are still going to be people out there who are not protected because they can't be vaccinated or they won't be vaccinated, or more importantly, they don't have access to the vaccines because of the way we're distributing vaccines in the world, which, by the way, is terribly unjust. So we have to keep up these other activities. And we don't know for how long, but I think we're beginning to forget, and this is the thing we all do as humans. We just want the solution. So vaccines equals the solution. I'm sorry, it's not the whole story. The vaccines are a huge part of a long-term solution. And as we get second and third generation vaccines, as we get better at the monitoring, we will get total control over this virus. We will. And there is light at the end of the tunnel. But now is not the time to let up. Now is not the time to relax. It really, really isn't. Or so many of us are going to be back in lockdowns again. So many of us are going to be exactly where we don't want to be. So sorry for
And I don't think you want to see us us doing these every week, you know, and telling you like to keep doing
Maybe
all
we'll
these
promise
things.
to go away.
Maybe we'll go away and you'll never hear from us again, and maybe that's the motivation that you need there. But Alex, can I just reiterate on the virus variants that we are seeing here? So from the information that we have on the virus variants, there are a number of mutations that have been identified in several of them that show that it can transmit more easily. It doesn't mean that the modes of transmission have changed. It still spreads between people. Most transmission is happening when people are in close contact with one another. Your setting matters. Indoor transmission happens more often than outdoor transmission. If you have close contact for prolonged periods of time, if you're not wearing a mask, if you're not physically distanced, if you have poor ventilation, all of that makes the situation riskier. And that is true for virus variants as well. We have not seen any data to suggest that the mode has changed in terms of airborne, fomite, vertical transmission, animal, human, any of that. It still spreads the same way. We haven't seen any changes in terms of virus survivability on surfaces or anything like that. So we continue to advise, we give recommendations on all modes of transmission, because all modes of transmission can happen, and we want to make sure that we take the steps, and we make sure that you take the steps to reduce your risk. And I think that's really important. But as societies are opening up, and if we let down our guard, and this is what worries us, this is what Mike just said, in the last 3 weeks, globally, we have seen an increase in transmission. With these virus variants, transmission is going to grow even faster. And we have variants that are of concern, and we have people's fatigue, which is a massive concern. And that combination with the fact that we don't have the vaccines everywhere where we need them is really dangerous. So let's not give this virus an opportunity to spread. Let's do what we can every single day. Think about what you're doing and make sure that you know what your risk is every day and take steps to lower your risk. You have the tools at hand. Follow the local guidance, keep your physical distance, wear your mask, clean your hands, practice respiratory etiquette, open your windows, avoid crowded spaces, working from home. One of the benefits of this pandemic, I have to say, is the fact that we, as WHO, normally we do a lot of face-to-face meetings. Because we have now gone into the digital world, we have actually been able to expand our networks and reach many, many more countries. We have worked really hard to expand our training so that we have now training in 50 languages so that we are able to actually reach more and more people. And I think I think that's going to be the new norm. Not every single time, but we've been able to actually reach people that have connections. There isn't internet everywhere, and that is also something that needs to be improved. But let's take this opportunity now to drive that transmission back. I want to see next week that transmission, and the week after that transmission is reducing again. We're seeing declines in deaths. We can still do that for transmission.
Thank you very much. And I actually don't think that people want to see you two go away. And I will end with what Karen Shea Donovan has written. Thank you for all you do. And she's echoing your call that we need all the brains, young, old, male, female, binary, etc. There is great power in diversity and the coming together of great minds. And in this moment when we're coming together, I just want to say that we have people watching us from the UK, Peru, Nigeria, Chad, Libya, Uzbekistan, the US, Kenya, Lebanon, Sudan, Algeria, Colombia, Switzerland, Saudi Arabia, Jordan, Iraq, Tajikistan, Kuwait, Argentina, Portugal, Panama, Dubai, Ireland, Timor-Leste, Malaysia, Morocco, South Korea, Brazil, Greece, Italy, Paraguay, and list is way longer. So this is at least one moment in a week where we come together to learn more from you. Thank you so much for your time. I wish everyone celebrating St. Patrick's Day to celebrate safely. And please follow the advice that Mike and Maria just said. We would like to see cases going down, and we all have a part to play in that. Until next week, stay safe.